when I got my first dog, my Raven 1-year-old Affin Pinscher, he came to me around 4 months, and at 6 months old, he still had his temporary teeth. And I read, of course, everywhere on Google that if Affin Pinschers, being small breed, don't change their teeth on time, you might require surgery. And also, my breeder mentioned that as well originally. So I was freaking out. I was like, I'm in Tanzania. I was in Tanzania at that time with this dog. And they, like, you can imagine the level of the vet care that they have. And I'm like, how can I put him under anesthesia and in that country? And it was just like rough, right? So I texted my breeder and I said, hey, what can I do for him uh, somehow do this process naturally? And she's like, well, you can give him raw chicken wing, put it in the freezer, and give it to him, and he will like gnaw on it, and this is how the teeth will go away, right? And then the temporary teeth will fall out, and the permanent teeth gonna grow correctly. And we're not gonna go into detail into this issue with Affin Pinschers and a lot of small breeds, but just so that was her suggestion. However, I knew that the thing with chicken bones was always wary to me. And even being a new dog owner, I was like, I don't know about this. So I didn't do it. I was like, I don't know. I don't feel comfortable doing this. Like, what if he chokes on it, whatever. So I went with a tug of war. I gave him a lot of tug toys. I played him with him all the time. He wasn't like a super chewer, but long story short, he didn't require any surgeries, and his temporary teeth did get out on time for his permanent teeth to grow okay. Okay, it wasn't perfect, but it was okay, and we avoided surgery and anesthesia and all of that mess altogether in Tanzania. But I still was kind of like, well, what about the chicken bones, right? Are they safe? Are they not? Like, everybody sort of knows that the cooked chicken bones are very bad and the raw are sort of okay, but are they? And I was like, I feel like I need to do a proper research and to learn about this myself and maybe help you as you're watching this. So today we're going to be talking about chicken bones, and let's compare raw versus cooked. And when I when I've read everything I've read and I did a proper research, I can tell you that one is survivable and one is surgery. So we're gonna just put it here. I'm gonna remove this. Survivable, survivable, and surgery. So by the end of this video, you will know which one is what. Well, it's kind of obvious, but it's not that simple. All right. So first of all, let's talk about bone structure and composition and compare those two. So raw are more flexible. I probably should be writing this not sideways so you guys don't get dizzy here. So raw chicken bones, they contain intact collagen fibers, bone marrow, and natural moisture. So this organic material gives them like slight flexibility and tensile strength, allowing them to bend or crush without immediately splintering. So veterinary anatomy sources confirm that raw bones maintain a semi-elastic matrix that resists shattering under pressure. Now, let's talk about the cooked ones. So they are dry and brittle. Okay, can you see it? I hope you can see it and figure out my, my writing. It's horrible. So cooking destroys the collagen and it literally evaporates internal moisture, leaving a bone that's structurally dry, brittle, and rigid. The calcium matrix remains, but the loss of collagen results in a bone that just like fractures so easily into shards when chewed. And I have a picture here of the bone. Okay, here. Look how sharp it is. I'm going to take red for this. I'm drawing on the inlay. So look, what's now? Okay, here. Yeah, look how sharp these edges are. This is pretty bad. So this mechanical fragility is like consistent across all species. So it's not only chicken, it's also turkey, pork, or beef. So not just chicken, any cooked bone has this problem. Going back to our thing. So next one is, let's talk about splintering behavior, right? So the raw ones have less splinter risk. I'm just like you guys. I haven't written anything in a long time. I've been only typing. So I'm like, like, am I even spelling these things correctly? So if chewed aggressively, raw bones may crush or break, but the edges tend to be rounded or fibrous, like not razor sharp like we saw before, right? So if we go back to this, maybe I can, no, there is that, yeah. Okay, so here we go back. So so the edge would be here. See how sharp they are. So here we would be like this, right? So they would be much less sharp, right? They would be rounded. So many raw feeders use terms like edible bones because raw poultry bones, for example, necks or wings, can be digested or broken down without fragmenting into little spikes like we saw, though the risk still exists. And your dog can ingest raw bone just as easily as the cooked one, and although the edges are rounded, it still might be lodged in his intestines, and your dog still might have problems. We're just gonna cover that soon. Soon. Okay, so next one is cooked. So cooked is very simple. It shatters like glass. All right. So splintering with cooked bones is the number one danger. Cooked bones frequently snap into like sharp, angular fragments, like you saw. And these pieces have been described in veterinary case studies as behaving like glass shards or needles capable of puncturing tissue anywhere from the mouth to the colon. Imagine that. It's crazy. So, in the whole dog's body, when he takes it in, the, anywhere as he passes it, that bone, that that shattered piece, can be puncturing stuff. And I'm gonna just show you guys so you can even like imagine. I'm trying to find my cursor. They, like, let's see, dogs dog's digestive system here. So you can just like picture this, how bad this is. Oh, my internet wasn't on. One sec. Here. Okay, so here. So this is dog's digestive tract. So imagine I'm gonna open it. Come on. It's still loading. All right, here we go. So imagine here, now you can see it good. So this whole thing, it can literally stop anywhere, anywhere, and puncture anywhere, and your dog will have to have surgery, and because it's gonna have a big problem. Like through this whole thing, once the bone is in the mouth, and until it passed anywhere through this, it can be lodged. Not cool. And that's about it for this. Now let's talk about risk to mouth and throat in particular. Okay. So what am I doing again with this? Okay. So with raw chicken bones, it's occasional mouth injury. What does that mean, actually? So injuries are possible, but they're just less frequent. A raw bone can still get stuck across the roof of the mouth, lodge between molars, or just abrade the gums if bitten into awkwardly, right? You probably bitten yourself awkwardly if you've ever chewed on a bone. Like my mom loves to chew chicken bones, and I always like say, don't do that because for exactly same reason. And at least we have hands as being primates. Dogs have paws, so they can't even like manipulate this bone to bite it correctly, right? So a lot of times they will bite it awkwardly, and that's when the injury might happen. So, right? Now, vets know that these cases are usually like not life threatening, but they might cause bleeding, gagging, or oral discomfort, obviously, because the mouth might get hurt. Now, on the other hand, the cooked bones extremely common to cause oral trauma. Extremely common to cause oral trauma, right? And I'm going to show you just that. So you can picture that. You can just, we just gonna type dog, chicken bone, um, mouth, trauma. Okay, you guys not gonna like it. It's not pretty. So here we have this fractured teeth right there. Like we talked, but this is for sure. Well, that's just not even what here. A malocclusion? No, malocclusion is not what we're looking here for. Mm. So don't, oh, Don't see anything in particular right here. I would have to find exact pictures. Yeah, don't see anything too bad here because for sure, and I don't want to spend too much time. But I'm sure you can find here if you look enough. But basically, here we see most of the teeth fractures, but it's going to be the shard's going to be inside the mouth. I just cannot find it right now. Yeah, no photos. No photos for you. All right. Let's get back to the now cooked. They're extremely common to cause oral trauma, and splinter bone fragments can cut the tongue, lodge in the back of the throat, or perforate the soft palate or even esophagus. So emergency clinics, they routinely report laceration injuries from cooked poultry bones, especially in small breeds like my dog. And this is just something that you have to keep in mind. Again, imagine yourself eating chicken bone or any kind of sharp object. You can have injury and so can your dog. Now let's talk about something really serious, which is choking and obstruction risk. So, although supposedly less less bad, but there is still possible to choke even on this, in even on the raw. All right. So, a risk exists, especially if bones are small, slick, or swallowed whole. A dog can choke on a raw wing, um, like not on a raw wing, on a raw wing tip, or like a drummet, especially if it gulps instead of chewing. So raw bones can also lodge in esophagus or pharynx, especially in enthusiastic eaters, let's just say. So yeah, your dog can choke on the raw bone as easily as on the cooked bone. It's just the outcome might be better, right? Because they're less sharp, but it still can have a problem. And also, I wanted to have to add something else here. Oh, the general rule is that the bone should be larger than your dog mouth. So basically, if your dog can just take and eat it, that's not good because your dog can choke on it. That's like the rule of thumb that the vets say. Now let's talk about cooked bones. It's a major choking hazard. Major, major choking hazard. Why? Well, very high risk of obstruction. Cooked bones have rigid edges, like we talked, and they often break into pieces that are just the right size to block the airway. These blockages can be fatal in minutes if the dog cannot breathe and emergency removal isn't performed. So, like we talked, the bone is so small that it's just a perfect size to block the airway and your dog is done, especially if you were not supervising them. Now let's talk about digestibility and breakdown. So, raw bones can dissolve partially. I think we need more space here somehow. Bear with me. I'm going to put this A little less. A little less big. All right. Fine. Okay. So, deselect here. Okay. Okay. I'm back. So dogs' stomach acid, which pH is very, it's very acidy, right? The pH is 1-2. So it can partially dissolve. So there that those acids can partially dissolve raw bone material, especially like porous poultry bones. But most small raw fragments will pass uneventfully or break down during digestion if the dog chews them well. However, large or gulped bones can still cause a blockage, like we talked before dissolving fully. So that's a problem. Although the acidity in their stomach should dissolve those bones, if the bones are pieces are too big that they swallow, that's what happens. It might not dissolve and then gets lodged, and then your dog requires a surgery. So the cooked bones are hard to digest. I'm just checking if I'm still recording. Okay, so cooked bone pieces are much harder and denser due to dehydration and heat damage, like we talked. So they resist acid breakdown and tend to remain intact, increasing the risk of intestinal blockage or bowel perforation. And I'm going to show you right now something not very pleasant. So check this out. Can you see the bone on this X-ray? Is it X-ray in English? You let me know. So this is, come on. This this is the bone right here. Here's a chicken bone for you. Let me know in the comments what kind of bone this is you think. Is it wing? Is it a femur? Is it a leg? Let me know. So basically, this is the leg, not the leg. Sorry, this is the chicken bone, and it's lodged right here. I'm gonna show you another one. Ta-da! Look at this mess, guys. So this is crazy. Look how many. So see those little shards here? These are multiple chicken bones, cooked ones for sure. So, like I said, they resist acid breakdown and tend to remain intact, increasing the risk of intestinal blockage or bowel perforation. Where do you think all these x-rays came from? From doctors. So all these dogs that are on this x-rays are unfortunately have been operated. So now, as far as we are on it, let's talk about the risk of internal injury. And the risk of internal injury for the raw ones. So it's low for the raw bones, it's obviously a lower risk, but still real. So we're gonna write here lower risk of internal injury. But the cooked ones, you will see. So the raw bones are still capable of injuring the stomach or intestines if chewed into sharp slivers, yeah, or large chunks. However, raw bone texture tends to be less jagged, so full perforation is actually quite rare. So risk increases with quantity or poor chewing. So if your dog is gulping those bones, that's when this risk intensifies. So now let's talk about the cooked bones. Obviously, high perforation risk. High perforation risk. Okay. So it's literally just high rate of perforation. Cooked bone shards can slice through intestinal walls, causing peritonitis, sepsis, and life-threatening infections. Emergency surgery is often the only treatment, and prognosis worsens the longer the delay. In case if you don't know what peritonitis is, hope I'm pronouncing this right. So I'm going to quickly show you. So this is the bone here again. Right? So the bone got lodged here. So let's just say that um it let's just say I'm gonna say so that was the intestine, right? Right, like this, something. So it perforated the intestine, right? Because it's so sharp. So once the intestine is perforated, the fluids that are in the intestines go out of the intestines inside the cavities. Just like if you want a human example, for the human example, that would be appendicitis, right? Why appendicitis is so dangerous is because of the peritonitis. When the peritonitis occurs, is this whole appendicitis ruptures, like the appendicitis, it's like appendix gets inflamed. When it gets inflamed, it might rupture. When it ruptures, that's when people die if they are not on time to go to the doctor, because once it ruptures, it's so hard to clean out everything inside. Those parts go into the bloodstream and who knows where. And it's like acute infection and it's just bad prognosis, bad scenario. You don't want this. This is very, very dangerous. So that's extremely important that this doesn't happen with your dog, or if it does happen, that you immediately rush him into the vet. But a lot of times we don't know that this is happening, right? We just see some symptoms and we don't know what those symptoms are. And so the next one is tooth damage. So the tooth damage for the raw bones, it's still dangerous for aggressive chewers, although they're more flexible. Still dangerous for aggressive chewers. All right. So they're still hard enough to fracture premolars or molars, especially in aggressive chewers or dogs with pre-existing dental issues. What does it mean? So I, for example, clean my dog's teeth once a week. If you don't, and your dog is older and you've been feeding him kibbles or whatever, like you just haven't been taking care of their teeth, that's what happens. Their teeth already like not good. They are like moving inside their gums, and it's they start chewing that bone, and the tooth can literally come out in the bed scenario. So vets often see slab fractures from raw marrow bones and large joints. Chicken bones are softer but not harmless, and we already saw on internet all those parts of the teeth just getting out. So now cooked bones. So with cooked bones, those, because they're often harder and more brittle, they are common cause of fractures. Common cause of teeth fractures. You know, I should have, like in this writing, I should have put like teeth, mouth, whatever, right? Next time I'll do that. So because those are harder and more brittle, Cooked bones are a leading cause of tooth fractures. Dogs trying to crunch down often snap teeth before the bone breaks. So these injuries usually require dental surgery, and those are extremely expensive. If you haven't if you haven't been to vet dentist, you don't want to go there. It's very, very expensive. The root canal can be up to $800. So I think it's the last one that we're going to cover. It's called bacterial contamination. So, and this one is very interesting. So, um, with the raw, it's foodborne pathogens. What does that mean, Yana? That means, I think we have to write down this here because I'm running out of space. Foodborne pathogens. All right. You still can see that. Okay. So raw chicken frequently carries salmonella, um, Pilobacter, like not Pilobacter, Campylobacter, Escherichia coli. I'm sure I'm mispronouncing all that. So dogs may tolerate these bacteria better than humans, but infections do happen, especially in puppies, seniors, like or immune compromised dogs. It's gonna literally just depend. Your dogs might get it or might not. Okay. Um, However, there is like a kick to this. So infected dogs may also shed bacteria in saliva and feces. So if you take the dog, just see here, right? If you take the dog, so that's a dog for you. So saliva and feces, both are liquids, right? So bacteria are living in those two right there for you. So you interacting with a dog, for example, dog licks you, right? A lot of owners like dog kisses and stuff like that, or you forgot the bag and you pick up their poop, whatever. That's when you will get affected too. So it's a high risk to household members. It's as simple as that. Where is this dog? Okay, here. So going back to our writing. So, the good thing about the cooked bones, there is no bacteria. No bacteria. Something good about the cooked bones. No bacteria. No bacteria here. How cool is that? Finally, something good. So, heat kills bacteria, and cooked chicken bones are microbiology safer to handle, but this offers no safety advantage for the dog since the splintering danger remains extreme. Um, so the last thing I think I want to cover is intended use and veterinary position, right? So the raw chicken bones sometimes are vet approved. It's going to depend on the vet. Vet approved, maybe, or sometimes. So some vets cautiously support feeding edible raw bones like chicken necks or wings if properly sized and supervised. This can provide calcium, phosphorus, and enrichment, but are not risk free, as we've noticed. So, raw feeding groups strongly advise following strict handling and portion rules. Because, again, if you overfeed chicken bones, your dog might have white stool because of too many of them. It's another disease. It's not good. Now, um, no vet approval for cooked ones. No vet approval at all. Never. Okay, so no veterinary organizations support feeding cooked bones. All major authorities, like including the AVMEA, FDA, and emergency vet clinics, advise against giving cooked bones in any form, including chicken wings, legs, or carcass scraps. And I think we still have to cover hygiene risk to humans. So, like we talked, raw bones require careful handling and surface sanitation to prevent human illnesses. Like we talked about the bacteria, children, elderly, and immunocompromised people are most at risk if exposed to contaminated surfaces of dog saliva. And if, in general, if you're raw feeding your dog, guess what? You are exposing yourself to the bacteria that might be on that poultry. And cooked ones, of course, safer to handle, but not to feed. So, safe for humans to handle post cooking, but remains unsafe for dogs due to structural risks. So, supervision requirements. The raw ones must supervise always, must be supervised at all times, right? Dogs should only be given raw bones larger than their muzzle, like I've mentioned, to discourage swallowing. So chewing sessions should be limited and unfinished raw bones discarded, and um yeah, they should be discarded after short periods to avoid bacterial growth. You want them to chew and then remove them right away and get done with them. As for cooked bones, obviously there is no safe way to supervise. No amount of supervision makes cooked bones safe, like we've discovered, and they should never be offered intentionally. And owners are advised to dispose of all poultry bones securely to prevent accidental ingestion. So if your dog is ravaging in your trash can, they will find it, they will ingest it, and they will require that nasty surgery, or they might just die. So, if your dog is not trained not to get into your trash, please make sure you understand that they might get it from your trash. So don't dispose it there. Maybe you just throw it away somewhere outside right away and far. And also, a lot of times outside there are so many chicken bones just laying around, so that he might find something on the ground and have the same bad situation anyway. So that's why it's so important that your dog is trained not to pick up food from the ground. And if you see him picking up chicken bone, immediately take it away or say leave it if he didn't take it yet, right? So um I would say let's quickly do this final thing, right? So both types can cause blockages, choking, and dental fractures. And I don't even know if I should write that. Probably not. I'm just gonna say it. So now both raw and cooked bones can result in emergency vet visits or surgeries. Dogs vary widely, so some tolerate bones, others suffer life threatening complications on first exposure, and that would really suck. So, might be eating bones forever, and one day they will get a blockage, and they might just try a bone today and will have blockage right away, or the dental problem is just a wild Russian roulette. So even natural bones can carry unpredictable mechanical risks, and vets generally advise safer alternatives like VOHC approved chews over bones of any kind. Okay, so I think this is pretty much summarizes this whole thing. I hope you learned something today. Let me know if you want um so basically, if you want like this videos in maybe different format or whatever, let me know. Any suggestions are more than welcome because this is a fresh channel. And so basically, which ones are survivable and which ones are surgery here, right? So it's very clear, I think, now. So potentially these ones are survivable, and cooked are definitely a potential surgery. So this is it, my friends. Remember to subscribe to this channel if you watched to this point. This is a Raven telling you to subscribe. and put a like on this video and leave me a comment and tell me what can I do better in these videos. Maybe I give you too much information, maybe not enough information. Who knows? I don't know. This is all fresh, and haven't done this in a while, this kind of videos. So I hope you guys enjoyed. Yes, let me know. Suggestions are welcomed. See you in the next one. Bye bye. How do I stop this recording? That's a question. My cursor is going crazy. It's because somehow it's on my iPad. Interesting. Yeah, very interesting. So I think if I disconnect it, now I can shut this off. Bye bye.